and nice to see you after the stroke session. I hope that was useful. And the latest talk in town, at least in Karnataka, is about cardiac arrest in the youth. And me and Gurleen just wanted to spread more awareness on this. And thanks to Dr. Karthik, who agreed at the within a 2-day window. He said, "Okay, let's do this." So without further ado, Dr. Karthik works at Aster RV Hospital, and he's worked at Fortis earlier. He has more than 5 years of experience as an interventional cardiologist, and he will be taking you through this topic today. And once he's done with his presentation, he will be taking the questions which have been on the form. And post that, if there is more questions that you have, feel free to ask, and probably we'll wrap it up after that. So I would request everyone to be on mute right now, and I will spotlight Dr. Karthik. Dr. Karthik, welcome to the session, and it's over to you now.
Thanks. So, should be sharing the screen?
Yes, sir. You are co-host.
Yeah, got it. Okay. So, I would be talking about prevention of heart disease in the young. So, the thing is that I am Dr. R S Karthik. I am a consultant interventional cardiologist working in Aster RV Hospital. Basically, this thing came in because there are a lot of things going on. A lot of people who are young, who are kind of having heart attacks and dying of that. See, this is something which we knew before, but unfortunately, with the turn of events some 10 days before, everything has come to the forefront. Somehow, celebrities are supposed to be kind of showing the way, and unfortunately, a guy had to show the way by dying. So, this is something which is known that, see, if you think you are very young to have a heart attack, no, you have to think again, because there are way too many things happening, and some things which we see which are very disheartening. Unfortunately, that's how it is. So usually my talk will be like this. We divide it into two parts. Part one, I talk about some things which are relevant to today's topic. Part two will be where audience want to ask whatever they have doubts about. Let it be the silliest of the things or most complicated of the things. We'll try to answer it honestly. This is something which the heart doesn't do. Unfortunately, people think that heart is something like this. No, it doesn't. It's also not this. Something which the heart does is this. Yes, if you like somebody, if you hate somebody, the heart does beat faster. We are talking about all of this basically because leading causes of death in the world in 2016, according to the global data, heart attack kind of takes the cake, 32%. We, with various studies, we have kind of come to this one that 30 to 50% of all the deaths are because of heart diseases. Some other data, this is 2010 from WHO. In this also we see that it is something like 30%. This is the Indian data. So this also we can make out very clearly that heart disease are the #1 causes of death in India as well, which was not known before. Before we are thinking that it's in Western population is common, but in Indian population it's not so common. But unfortunately we're proven wrong. It has been more than 15, 20 years now. So coming to today's topic, what are the reasons for heart diseases in young? See, there is a big topic of congenital heart disease, in the sense something that we are born with. I'm not talking about that because that is not relevant. Okay. So I'm talking about acquired heart diseases. So in that, say 86% of this, whatever we call about heart disease in the young, usually we kind of take it up telling that anybody less than 45 years of age is considered as young heart attacks. So in this, conventional risk factors are actually kind of causing heart attacks in 86% of the population. Rare causes, something what we should know is that conventional is sugar, BP, cholesterol, all other things kind of cause heart attacks in 86% of the population, 86% of these people. only about say 15 to 20% is because of some rarer causes or some other causes which are not there in older people. So in this, obviously, substance abuse always takes this one where people feel that it's very important. In Western population, yes, in Indian population, it's bit less. Not really less, but bit less. So this is one of the best slides what we can put up, telling that what are the reason for it. I'll try to simplify it. See, in normal coronary arteries, in arteries which have no typical structural problems like any cholesterol deposits or any damages, then coronary artery spasm. Okay. In this, the artery structurally is normal, but it gets into spasm where the artery narrows on its own. This is because of most commonly known in cocaine and amphetamine abuse, and also in alcohol if it is taken in significantly more quantities. Some things which we see very, very commonly of late is hypercoagulable states. This simply means that the blood has increased tendency to clot. Antiphospholipid antibody syndromes, nephrotic syndromes are very common. Embolic phenomena in the sense, some things which are not in the this one arteries, which has come from somewhere else. So endocarditis, if there's any infection in the heart, or paradoxical embolism when you have any holes in the heart. If the coronary arteries are abnormal, there are a lot more reasons to kind of cause heart attacks. Something like where cholesterol deposition, atherosclerosis means cholesterol deposition. This is accelerated by smoking, the number one cause in younger patients to have heart attacks. Diabetes, familial hypercholesterolemia, where there is a familial tendency to have increased cholesterol. Combined hyperlipidemias, type 2 remnant dyslipidemias, or abnormal coronary arteries, where it is coming from not the normal location. Spontaneous coronary artery dissection, if one of the artery layers of the heart suddenly gets dissected on its own, it can be during pregnancy or peripartum, due to immunosuppression in cancer patients, in hypertensives, and coronary artery aneurysms, where there is abnormal outpouching of the arteries. In Kawasaki's disease, it is typically in childhood. So, what is heart disease basically? See, heart is an organ which basically works as pump. Okay? It pumps 4 to 5 liters of blood every minute during rest, supplies nutrients and oxygen-rich blood to all parts of the body, including itself. Coronary artery disease, always we speak about. So, what are coronary artery diseases? Coronary arteries are arteries which supply the heart. That's all it is. Okay. Usually, the most important myth, what we know is that heart disease starts after 50, 60, 70, whatever it is. It doesn't. It actually starts from 20 years of age to 25 years of age is the maximum. Slowly, you can see the progress in this slide where it starts just showing itself by to a second to third decade, and after that, it slowly progresses. This progression may not be as I've written. This progression can be quite fast, depending on what are risk factors they have. This slide is being presented from a journal from 1998. Okay? This is 25 years before knowledge. And last thing in this slide is that, see, that is the plaque which is forming. The yellow color part is the plaque, cholesterol deposit which is forming. Once it becomes significant enough, that is more than 50% to 70%, it bursts open, forming a clot. That is what is a heart attack. Till then, it is not a heart attack. Okay. So some things I will not come in a very significant order. I am going to come in abstract ways of kind of presenting this. So what I'm going to talk about is this BMI is what we typically calculate, the 23, 25, all of this is not in our population. It's in Western population. Our population, it is much lesser. Okay. Normal weight in our population is 18 to 22.9. Overweight is considered to be 23 to 25. And anything above 25 is considered as obesity. This is very important because Western population only 30 above we consider it as obesity, which is wrong for Indians. Even abdominal obesity in Indians, the waist circumference is definitely lesser. It is 90 centimeters. In men, 80 centimeters in women. In Western, it is significantly higher. because our Indian build is not equivalent to the Western build. So that's why there's difference. This is simple terminology which you can understand rather than calculating BMI. Depending on your height, whatever your height is in centimeters, reduce 100 in it, that is your ideal weight. Rather than kind of trying to calculate it very complicatedly, this is the simple way of putting it through. Okay, so that you can calculate anybody's ideal weight right away. Okay. So yeah, this is something I was supposed to kind of tell. I was trying to tell in the previous slide. Coronary artery disease, see, that is the plaque which is starting in the first on this one. Next comes in angina, where there is narrowing, which is significant, probably more than 50%. There is some difficulty in blood going through. That's why that angina comes in. Heart attack is when the significant narrowing opens up into a clot. Till then, heart attack doesn't happen. Because a lot of people ask us, there's a references training that what is a block and what is a heart attack eventually. Heart attack is when this block opens up, forms a clot and occludes the artery. Means to say the artery is fully blocked. It's not flowing anymore. Okay. So, a lot of reasons other than this, mental health has a big role to play in this. Depression, anxiety, stress at home, stress at work, all of this significantly contribute. Most important slide I would like you to know is that what are the common kind of heart attack signals, signs? See, heart attacks always give you some time where you have to act. If you recognize it earlier, you are usually safer. If you recognize it later, it's always trouble. See, chest pain is something everybody understands. Typical pain, what is from the heart, is usually in the center of the chest or on the left side. Squeezing kind of chest, heaviness can be there. It can radiate to your inner part of the arm, or it can radiate to the jaw or the abdomen. All of this is part of the same thing. A lot of times we ignore it as gastritis or some other things. It is usually not. Okay. Any age, if you look at it, if at all there is some of these symptoms, you should kind of always consider heart attack as first possibility. It can be lightheadedness, you can have nausea or vomiting, you can have discomfort in the arms or shoulders, you can have shortness of breath. So all of these are things which we kind of put through from various organizations from the heart so that people know. One of the more important things people do ask us is what is cardiac arrest and what is heart attack? They always think it is the same. See, heart attack is when an artery is blocked, which is not supplying the part of the heart. They start having pain or any other symptoms. All these things can be there. The earlier you open the artery, you are safer. Earlier you open the artery, the heart will be less damaged and you can kind of lead a normal life. The later you open it, the heart may be more damaged. So that's where it is. Second thing, cardiac arrest. Cardiac arrest means that the heart has stopped. Okay, it can be once the heart goes into overdrive, beats very fast and stops, or it stops fully. Both are considered cardiac arrest. Heart attack is an emergency. Cardiac arrest is an absolute emergency because cardiac arrest you are supposed to act then and there. Heart attack you have to take him to the nearest hospital and let them work on it. But cardiac arrest you should be doing CPR. So somebody was kind of asking about it. See, CPRs has to be learned by everybody. There's no question about it. The more people learn this, more people are safer, and your own family members will be safer. I think we will be requesting Mayur to kind of talk to you about this, and as and when it's possible, we'll try and get you people into CPRs in groups. We have mannequins where you can try and do this so that at some point of time, if you kind of get a chance, you will be able to save a life, which is very, very, very fulfilling. Okay. So it's a big problem. What data I'm showing you, 12 million deaths annually, is a very old data actually. No, it's significantly more. So in Western population, because of all of these awareness campaigns, government programs, the heart attacks technically is decreasing in its progression. But in India, it is significantly increasing. A lot of reasons, physical inactivity, nobody wants to do anything, smoking. So most important thing is that in young, if we talk about, smoking forms the most pivotal part in causing a heart attack, because this is something we see very, very commonly. Every week, at least, we see 2 heart attacks which are less than 45. And whenever you ask them smoking, they say yes. Very, very rare that they don't have smoking and they have a heart attack at younger age. So smoking has to be quit. Whoever it is, your friends, your family, please make sure that you put in an effort to make them quit smoking, because that is the most important factor. I'll be talking about it more in detail, but this is how it is. Alcohol consumption, they always told that alcohol consumption is one of the ways you can protect your heart. Not really a way to look at it, telling that I drink this much and my heart is safer. Not really. So there is a lot of evidence against it. The evidence to say this was long back, and they told that red wine in some quantity is safer, but for the heart, maybe to an extent, but for all other parts of your body, absolutely no. So all of these risk factors, conventional risk factors like diabetes, almost 50 to 60% of people when we see with heart diseases are known to be diabetic. And very important thing, maybe a bit difficult to understand, but let me simplify this. Interactions of risk factors. See, you have one risk factor, you have two risk factors. 1 plus 1 doesn't become 2. Okay. So 1 plus 1 becomes 4 or 5 in this. So any risk factors which combine significantly grows. It can be that it operates in continuum. It can be multiplicative. And all of this, even minimal elevations, can kind of act as a significant elevation. So it's like misfortunes always come in by the door that has been left open for them. So whatever you do also is the most important thing for heart diseases to kind of form. So every day you have to kind of get up and make a choice that either you protect you and your family, do something about it, or you ignore it and eventually leave it to this one that something can go wrong. This is also pretty true that I always want the best mechanic for my car, but just a minute, sorry. Yeah, always I want the best mechanic for my car, but for health I will take anybody's and everybody's advice. Not the way to do it. Okay. So a lot of creative strategies, we say that you should not take this medication, you should not do this, you do that. A lot of things are told, but it doesn't work. Few things what we can talk about. What all can you do to prevent heart attacks? See, look what you eat. Okay. So more vegetables, more fruits, eat a variety of grain products, choose non-fat or low-fat products, use less fat meats, switch to fat-free milk. All of this kind of will help you significantly reduce your this one risk of heart diseases. So, and every time when you're eating, look at it. Do you feel that you have satisfied your hunger? Is it enough, or should you go on eating more? So that is something you have to always choose. A lot of dietary guidelines will be there. Right now, simple terms are these. Limit your intake of high fat, high calorie foods, including soft drinks, candy, junk food. Limit foods with high saturated fat, trans fats, and cholesterol. Try to limit your salt intake. We are saying 5, we are saying 4. No, 4 grams of salt in a day is more than enough. Have lesser alcohol as possible. And something which is very important is breakfast should be your biggest meal of the day. Dinner should be the smallest meal of the day. If breakfast is kind of, maybe say in a day, if your 50% of your meal can be the breakfast, that will be the best way, because once you eat breakfast, you have a lot of time till you sleep to burn it. Okay. So once you eat lunch, you have lesser time already to burn it. In the dinner, you hardly have any time to burn it. So that is how it is looked at. So try to eat biggest breakfast, smaller dinner, smaller lunch, and smallest dinner. That will be the best way to do it. So know the latest with whatever guidelines we got, whatever trials have been made in last 5 to 10 years, ultimately we have come to the conclusion that carbohydrates are the biggest culprits. So carbohydrate rich foods. What are carbohydrates? Basically any breads like roti, chapati, this one, the ragi ball or your rice. These are all typical carbohydrates. Try to reduce it. I'm not telling you to stop it. I'm telling you to reduce it as much as possible. Very difficult to do because carbohydrates are pretty filling and that's what you kind of satiate your hunger with. So when that is the case, try to reduce it to as much as possible over a period of time. The best way to do it is reduce carbohydrates by 10% every month. If you do that, by the end of 6 months, you would have reduced it by 50%, which is pretty good. Oils, see, a lot of these things are told, but oils, the way things are, no, is try to see which oil suits you, try to use it. Particular oil is good, particular oil is bad. Not very much because oil intake is always not really great. It is always minimal if you consider it. For that reason, try to reduce it as much as possible and eat a particular oil. That's okay. So exercise, I think I'm talking to a lot of people who are runners. So this is something which is important. When you start your running or say you're walking or whatever way you kind of keep yourself fit, try to start it slow. People kind of get excited, they want to start it, they want to start it very aggressively, and they overdo it. For that reason, try to start slow. Usually, what we teach all of our heart patients is that you start your activity at a particular this one. Say, if you are walking, if you are going to walk 1 kilometer today, start with that, which is not going to tire you. Do the same activity for a week. Okay. Once you do that, increase it by possibly 10 to 25%, whichever way you are comfortable, and do the same thing for the whole week. Next week, you increase it slightly further. So, usually, what you want to kind of achieve, say a 5 kilometer run you want to do it at the end of 3 months. So, start slow and reach there by 3 months so that you give your body enough time to acclimatize to it and it will be able to kind of cope up with that kind of activity. In simpler people, say people who are not running and all that, we say that at least achieve this Google Fit 60 hard points. Why Google Fit? I'm not kind of marketing something, but see what this was done is in Google Fit, we as Cardiology Association got kind of associated with this and we did that, telling that if a particular person walks at this speed and for this much time, say 1 minute, if you're walking at a reasonable amount of speed, it will be considered as a hard point. So if you do this for 60 minutes, that kind of is reasonable work. Okay, that is for people to know what is brisk walking. So that should be tried. And I am again not telling you that from day one you start this 60 hard points. I would say that slowly start with say 10 points or 20 points and reach 60 at the end of 3 months. That would be better. So exercise, other than just kind of reducing your weight and this one, but it also helps in improving all of your functions of each organ of your body. So it is very, very important. It does increase what is called as HDL, high density lipoprotein, which reduces your chance of forming blocks. It lowers LDL and total cholesterol, which are supposed to be bad. It reduces incidence of obesity, helps control diabetes and hypertension better. So there are a lot of trials to say that exercise helps people kind of live longer. That doesn't mean that we exercise significantly. And see, there's some exercises off late, I think from the time of lockdown they started where they do high intensity exercise for very short period of time. That is something which is dangerous for heart. So you have to kind of start a bit slow with this and go, and short term intense exercises should be avoided. It reduces the chances of diabetes, it reduces the chance of strokes or heart disease. Regular exercise, the blood pressure in hypertensives and all can go down significantly by 20 to 30. So we prescribe from cardiology, this one we prescribe that mild to moderate physical activity for 60 minutes for 5 days a week is recommended. What sort of exercise you want to do is something you have to decide. That is always the best way to go, because some people like jogging, some people like running, some people like to play, say, court sports, something like badminton, tennis, anything, whatever you like. Why am I saying that is basically because, see, you like to do something, you are going to do it for longer time. If you don't like to do something, whoever pushes it, you are not going to do it for longer time. Eventually, you will kind of lag off. So that's why. Exercise, you don't have to do it in gym, you don't have to do it in some fancy this one. If you can, just go outside your this one and comfortably walk wherever you feel comfortable. And smoking, some things which has to kind of go. I think smoking causes cancer, all other things are well known, but see, smoking causes heart disease, which is more problematic, because smoking causes cancer, it may take some time, but smoking causing heart disease doesn't take much time. And smoking causes this heart disease in people like, say, they're young. The heart is not prepared that you will have heart attack and you can die. So it is not prepared for it. So there is something that if you start having these blocks 10%, 5%, 20% at a time, the heart also prepares and creates alternative pathways. Okay, there are three coronary arteries. So one of these arteries, if it is getting affected, the other two coronary arteries try to supply it by forming channels. So this is what is called as ischemic preconditioning. So heart starts to make a pathway so that it knows at some point of time this guy is going to have a heart attack. I'll try to protect him. What it does is, one, it reduces risk of your death from the heart attack, and it reduces risk of significant heart damage. So both these things are kind of protected by it. That is not there in younger people who have heart attacks because of smoking. One. Second thing, people who smoke, they may not have TMT positives, treadmill test positive, all of this won't be there in them, because their heart attacks are not because of cholesterol deposits, their heart attacks are because of clots directly. So this is where the heart will be caught unaware and it can go into overdrive suddenly. So smoking has to stop. Whatever said and done, if you want our help, we can always help you with some way. There are a lot of ways to kind of make you quit smoking, but you have to be motivated enough. And benefits are way too much beyond just heart disease. There are so many things which can be there because of smoking. All of this can reduce. Most important thing, please know your number. In health, we have particular numbers we should know. So what are these? Total cholesterol is supposed to be less than 180. LDL, low density lipoprotein, has to be less than 80. HDL, high density lipoprotein, has to be more than 50, preferably more than 60. Triglycerides have to be less than 200. These have to be your targets. The other one, what I have not added is, I think BMI I spoke to you about. The other one is blood pressure. Blood pressure has to be 130, 85 below. Okay, that is the cutoff. Anything below that is considered normal. So benefit of reducing cholesterol, 10% reduction in the blood cholesterol produces 20 to 30% decline in coronary heart diseases. So this is a well-known fact. Blood pressure, as I told you, less than 130/85 is something which is very important. So controlling blood sugars. The simple this one is that your HbA1c, which is called as glycosylated hemoglobin, which is an average of your blood sugar for 2 to 3 months. This has to be less than 5.8. No, we consider it up to 6. So it has to be less than that to say that you are non-diabetic. And if you consider this fasting and postprandial, it has to be less than 100 and 110 in fasting. Postprandial, it has to be less than 140. If it is high, obviously you're supposed to take care about all of this. So if you or someone in a family already has been diagnosed with heart diseases, don't get disheartened. In a way, law of unequal this one, people who have heart disease kind of tend to live longer. Why is this? Say once they have had a problem, somehow it has been sorted out, or say people who are diabetes or hypertensive somehow tend to live longer, basically because they're getting it tested regularly. They already are aware that what problems can happen. They always watch for it. So they somehow live longer than people who think they are healthier. So that's why don't get disheartened. So you have to monitor things a bit more aggressively, like say eating healthy, walk regularly, watch your weight, quit smoking or any other bad habits what you have, keep your weight under control. Additionally, improving your heart. So by doing all of these things are better. Adhere to your medication. See, don't listen to a lot of people telling that this is not right, that is not right, this medication is not right. See, they don't know. So talk to people who know. See, don't wait for heart attack to take an action. Don't wait for second life because we don't have any. So this is something I'm showing in all of my presentations of late because see, there is a lot of myths about this. See, this is how typically a heart attack happens. The first one where the cholesterol deposits and clots is so much that that is not able to grow through. Then this is how the stents are placed. It is loaded in the balloon and placed it in. And once stent is placed, the artery flow improves. This is how it is. I just wanted to put it through. Lastly, heart diseases are often avoidable. Following a heart healthy lifestyle doesn't have to be complicated. It can be very simple. Doesn't mean that you have to get deprived of all of the good things what you want to do. You can do it. You can do it with a good plan. Instead, find ways to incorporate heart healthy habits into your lifestyle, and you may well enjoy a healthier life for years to come. Thank you. So this is something we did from our hospital. Because of runners, there are so many people who come into us asking what they should do, what they should not. So we have put in a package, what is called as runners package, specifically for runners, where we test the most important things, what is required, and say that before they start or once they have started, they are doing all of this. This is what is required. Every year, probably once you do this, if things are okay, then absolutely you can go ahead and do all of your activities. And something which I'm going to tell you, see, the problem is we are seeing this from some time now that a lot of the runners, we have had at least few bypass surgeries, multiple angioplasties in people who run daily. This is also we are seeing. That means to say, just because you run, it doesn't mean that you are not at risk for heart disease. There are a lot of other things except just exercise, which is also causing heart diseases. So you have to watch out for it, nothing else. Okay. Thank you.
So can we take some questions, Doctor?
Absolutely, no problem.
Sure. So we have already got some questions in advance, so I will just copy paste those questions in the chat box.
No
I can
problem.
read it out also to you, and whatever you feel like, most of those you have already covered through your like beautiful presentation, and it was very eye-opening and scary at the same time. But it's a good, very nice session. So I'll just check out the questions.
Yes, one question they have kind of somebody has put up is CT iotogram. See, the thing is that there has been a lot of myths being spread by a lot of people who are in good positions that CT iotograms are really good. I don't agree. Basically, because CT iotograms are supposed to be done in people where it's indicated, not in everybody or anybody. See, CT iotograms are done when, if at all there is a problem where you say that TMT is positive or there's a typical symptom, and always CT iotograms will be done only in people who are less than 50. Anybody who's more than 50, we don't do CT iotograms. Basically, because CT aortogram is considered reasonable if it says that there are no blocks. If it says that even one block is there, we are going to again do conventional angiogram, basically because CT aortograms are not good reproducible tools if they say blocks are there. Because CT aortogram says blocks are 30%. We see that blocks are 80% when we do conventional angiograms. In the same way, CT diagrams say that the blocks are 80%. When we do conventional angiogram, we say that blocks are 30%. So a lot of false positive and false negative results. So it's not reliable. I would say rather than CT autograms, do your conventional treadmill test. That is the best test what you can do. So that is one. And yeah. So person involved in regular high intensity workouts or running, is it necessary to get an ECG echo and other tests done? Top doc from Bangalore says it's all necessary, whereas AIMS doctor says it's unnecessary. It might cause other effects. Please clarify. See, the thing is that to kind of have this ECG echo and other tests, why is it important? See, people who run, there are some people who kind of suddenly die during sports, suddenly die during running, suddenly die during marathons. All of this is because they have some pre-existing conditions, something like hypertrophic cardiomyopathy, long QT, short QT syndromes, which can be diagnosed by ECG. Hypertrophic cardiomyopathies can be diagnosed by something called as an echo. So all these things can happen where you do it once you are initiating this one, running or any activity. It's better to get this done so that you know that you're not at risk. Once you do, every year is it necessary? Don't think so. Regularly, in a sense, 1 year, 2 years, 3 years, depending on your profile, we can advise you about that, and you can do that much. It's good enough. Not that every year compulsory you have to do. I disagree. See, a lot of doctors have a lot of opinions, but what I don't like is if you are giving an opinion, let it be from a guideline. It should not be that I want to just fancily comment something and talk about it. It should not be the case. It has to be that whatever you're talking should be evidence based. How can we keep check to prevent block and heart attack? What we told you, diet, exercise, all the things is okay. Second thing, to kind of know that is there a block already which is significant, maybe a treadmill test is the best way to do it. I'm running 5 times in a week and 2 days walk. Is it safe? No other hard workout at all? Please guide. See, the thing is, intensive activities of running and all that, if you have started doing it kind of in a graded manner, it is supposed to be safer. But very intense activities are never considered to be safe from heart. Let me tell you that. Mild to moderate intensity activities are considered safer. High intensity activities are not considered safer. Why is this? Let me give you an example. There was a test done, a trial done in 1,000 marathon runners who kind of ran marathon on this one. So what they saw was the enzyme which is released in heart attack, what is called as troponin, in significant amount of them, majority of them, the troponin was elevated. That means to say, if it is intensive activity, you can have mini heart attacks. Okay, so but in long-term follow-up of these patients were never done because nobody was serious about it and nothing happened. But we saw that there is significant damage to the heart when you start doing these activities suddenly or in a very erratic way. Okay, so that is why it is not considered safer. Self-check symptoms, as I told you, any chest pain. Simple way is that, see, till now you are able to do, say, climbing up 2 floors of stairs comfortably or walking this much distance comfortably. Suddenly you're not able to do that. You're feeling, say, some chest discomfort, some breathlessness when you're doing that kind of activity. That should raise your alarm, telling that something is not right. This activity which I was able to do before, suddenly I'm not able to do this. So that is not acceptable. If you are not doing this activity regularly and suddenly you feel breathless about it or chest pain is there with that, that is not the problem. If you're doing this daily and you're not able to do it one fine day, it's a problem. I think difference between heart attack and cardiac arrest, I did explain. Cardiac arrest is where the heart is fully stopped. Heart attack is where one of the arteries is blocked. That way it is different. See, cholesterol, one more thing I probably didn't put through is cholesterol, 35% is by your food. 65% is by your own body's metabolism. So it doesn't really matter what kind of cholesterol increase will be also there in your body metabolism. So if cholesterol is on the higher side, food also is a problem and your metabolism. So exercise, all other things come in basically for that, not just for food. So both have to kind of be taken care, not just one. Constipation with heart disease, till now with whatever we have kind of known, there is no correlation per se. Despite following healthy lifestyle, why do some people suffer heart attacks? It's confusing. Please clarify. See, healthy lifestyle is one. Food, your risk factors, what your genetics are. You can't escape your genetics. So if there is a family history of heart disease, you have to be very careful what you're doing. That's why all these tests and other things are basically for that. That in spite of you being healthy, we have to see that is there some problem in your heart? Is there a block which is developing? Because see, eventually most of the people will die with heart attacks. Say they may die at 60, they may die at 80, they may die at 90, or they may die at 100. So usually the end is because of this. So the more healthier you are, you kind of prolong it longer. The less healthier you are, you kind of have it bit earlier. So that's how it is. And in people who suddenly do this high intensity activities, or they are not kind of doing something, suddenly jump in and start doing this one fine day, then what will happen? There is a, say, cholesterol deposit which is 10%. Technically, which is not supposed to form a heart attack, kind of opens up because of the stress you are putting it through and forms a heart attack. That's why healthy people suddenly have heart attacks. And see, for all we know, it might not be heart attack. It may be just a cardiac arrest from some other reason, which we don't know. Unless we do something called as post-mortem, we will not know why a person died. This is all assumption that yes, it was a heart attack. It may be just cardiac arrest because some other reason as well. So other than this, are there any treatments available for MCD? I don't know what is MCD per se.
Microvascular cardiac disease.
Okay. Microvascular cardiac diseases, basically, see, the thing is that microvascular cardiac diseases usually don't cause, say, fatal diseases per se. This can cause some pain, this can cause some discomfort. Basically, what is it? The last channels of the heart, the last one, whatever will be there, what are called as capillaries, in these blocks are there, which can't be taken out. Okay. So you can't clear it out by any other way. So there are some this one for it, but it technically can't be cured. We can give you some medications and all, keep the things in control, but it clearly can't be cured. Because whatever having said, blocks don't clear off. You can treat those blocks with medications to say that it doesn't progress. But once it is there, it is there. Maybe with medications and all, it can come down, say, probably 5%, not more than that. Because the blocks are not in the innermost layer of the artery, it is in the second layer of the artery. So it is not accessible directly by a lot of things what you give. There is a publication that said many runners who had great heart-related reports and tests underwent DVT during marathons mostly. DVT unlikely, because DVTs happen when you're not really mobile. So DVTs are unlikely. There can be some other reasons, but DVTs are a bit unlikely. Second, high lipoprotein risk for heart disease. Yes, it is. I think we spoke about this. A person having prolonged existing hypertension of 150 by 90 and is on high BP medicine, what are the precautions that you would recommend? I would recommend that first you please change your medications and get your BP to 130 by 85, because 50% of our population is hypertensive. So let's be very clear about that. 50% of our population is hypertensive. So majority of problems, say heart attacks, strokes, peripheral arterial diseases, most of the other non-communicable diseases, hypertension is one of the most important risk factors. Okay. So if you see in all of these diseases, if you kind of form a this one and where we see that 50% or 60% of them are hypertensive. So one of the most important risk factors which should be treated well is hypertension without any question, this one doubt. So hypertension has to be treated better. If you're taking medications and you say that my BP is 150/90, I would say no. One is you have to change your medication and your target should never be 150/90. It has to be 130/85, always. I lost my mom 21 years ago at age of 43 to cardiac arrest and younger bro at 42 for cardiac arrest. I am 46. What precaution should I take? See, for you, I would say that first thing, you have to get your whole thing, say lipid profile, echo, and a TMT done. If at all there is any high index of suspicion in any of this, we will probably be putting you through some other tests to determine that there are no blocks right away. So this is most important, one. Second, we always kind of do something called as thrombocheck panel to check for any procoagulable state or hypercoagulable state, which can cause heart attacks. So in familial, this is one of the things which you should always very carefully look at. And a lot of times we do ignore it, but we have to do this. I think those are the questions.
Those are the questions. So
There is a
thank
minimum
you.
age for a person to get a heart attack. I've seen a heart attack at 16, 1-6. That is the least I've seen till date. That person had familial hypercholesterolemia. So all our family members, the cholesterol is through the roof. So they had to be treated with particular things. So their cholesterol has to be treated very aggressively compared to other people. Their targets are different. No, having said that, with say last 5 years, we have got something called as medications which specifically target this familial hypercholesterolemias. So those act very well in them. So we have a solution for them as well now, which was not there 5 years before. And see, regarding the other part of your question, what is the minimum age of a cardiac arrest? It can be 0 as well. Okay. The day the person is born also can die because of cardiac arrest, because these are congenital heart diseases. If it is not diagnosed in pregnancy, they can die on the day when they are born as well. That's why I didn't speak about congenital heart diseases, because it complicates the whole thing. It's very difficult to kind of talk about all of this. But people who have done their kids this one where 20 years, 20 days, 20 weeks of pregnancy, they do something called as anomaly scan. In this, majority of them are recognized, and usually if it is that risky, they tell them to terminate. So that will be done. So if they have done that, chances of that is very less. How can one who is hypothyroid take better care of one's heart? See, hypothyroidism, it's a simple thing. Thyroxine is less. Thyroxine has to be taken. That's about it. Other than that, no other thing has to be worried about. You are taking thyroxine tablets 6 months once. You will be testing your thyroid parameters. If that is good, you are essentially a normal person. There's no extra risk at all. If you don't care for your hypothyroid well, then yes, it does. But if you are taking care of it well, then there's no problem.
So I guess those are all the questions. So we would not take any further time. You already spent a lot of time and you have shared your all the wisdom with us. Thank you again, Dr. Karthik, for that, and thank you for wonderful session and presentation. It was really eye-opening and a little bit scary also, but at least we are aware now. So, and we'll spread this awareness also. The recording also we will be sharing with everyone. And two things that doctor had mentioned, I would like to again point out is one is CPR. So we had arranged CPR with Aster Hospital in person also before COVID with the mannequin and all. It was a wonderful experience practicing on the mannequin, like how in the real life situation. So we had done that one session. We had earlier with the doctor, like online session also with the awareness. We will arrange another session for members. So we will keep you guys updated on that. One image, Dr. Karthik, you shared test for runners and athletes. So that image also I will share. I was discussing with Mayur also on that. So those tests can be done through Aster also. So Aster RV. So we will share that image also, and we will encourage everyone to take those tests also. And thanks again for your time and wonderful insights on this.
Mayur here. I'm not able to switch on the camera, but thank you for taking out your time. And thanks a lot. I hope everyone had a eye-opening session. Thank you, Dr. Karthik.
Thank you, Mayur, for arranging and coordinating. And we would like to thank on behalf of Running Roadies and all the members present here. We'd like to thank again Aster Hospital, because they spread light on this. Like, people should avoid reaching hospitals, which is counterintuitive. Like, but they like make sure that time to time they are putting light and awareness.
See, the whole point is nobody wants, say, cardiologist doesn't want to see an MI. See, we are kind of trying to treat it, but the problem is that we don't want to see anybody in that situation. So that's the whole point.
Right. It's wonderful. So we will have like lot more session in future and lot of awareness walkathons. We were part of those also, arranging that also, walkathons, marathons and all. But yeah, thanks a lot, Doctor. Again, Dr. Karthik, thanks a lot. And
Thank
with
you.
this, we'll wrap up the session. Okay. Bye bye. Bye everyone. Take care.